Trucker Jim right here. I want to explain healthcare to you so that you kind of understand what happened. And I just ran the number, so I'm gonna tell it the way it is. When I was in 2010, when I was working at a different company, I was paying $95 a week for healthcare. That's 49.40. That's $4,940 a year. I don't remember the deductible. I think it was 3,000, but I don't remember, to be honest with you. In April, no, yeah, the very first of last year, I took insurance, and I got the insurance. It was a private insurance through United Healthcare systems, and I was paying $550 a month with a $5,000 deductible. It was a private insurance, PPO, United Healthcare. Um, so in April, I had a heart attack when I was working up in Wisconsin, and I had to have a stent. I was rushed to the hospital, and I had to have a stent put in my heart. Um, it was the main LED. If you know anything about that, that's the Widowmaker. The nurses kind of laughed at me when they came back into my room, and they told me that I asked them, why you laughing? They go, well, because your LED was clogged 98%. I said, well, what does that mean? She goes, well, the main LED is usually, we call it the Widowmaker. If that clogs, you die. And somehow you made it through that. So I'm grateful for that. So, I mean, I felt good that I had the health care insurance and everything. I didn't have to do anything. I didn't have to put no money down. So, but it was a 6 month policy because I was late. I couldn't get into the exchange. So I didn't care because I had a PPO, and my wife was covered too. So I mean, she also came down with a situation where she had to go to Northwest Hospital, and she was diagnosed with Still's disease, which is incurable. So I mean, she needs to go to Northwestern Hospital. I'm just going to throw that out there. So, like I said, I was paying um, $551 a month, and I thought everything was good. So until I started getting bills from the hospital, which is $43,000 in case you want to know. That was just for me, and that didn't count the $2,000  5 mile ride in an ambulance either. My insurance company paid $5,000 of it. $5,000. They want me to pay the rest, and I had coverage. Anyway, so since it was a short-term policy, it ended in July. So I called them up and I says, hey, okay, I need to extend my policy. And they says, well, okay, no problem, but we have to ask you a couple of questions first. I says, sure. Have you or your wife ever had anything blah, 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 blah with your heart? Or blah, 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 any kind of disease? And when they said that, I thought it was kind of funny, but the insurance company knows what I did. They know what my wife's doing. So I told them, yeah, I had a stent put in my heart. And my wife was diagnosed with Still's disease. So he goes, nah, that's not good. I go, what does that mean? He goes, well, we can't redo your insurance. I says, what are you talking about? I says, I got you. I've had you. He says, no. He says, the only thing we can do is we would have to exempt your heart and exempt your wife's disease. I go, why? It's not like I'm lacking coverage between the upgrade. He goes, well, he says, but that it's going to be a pre-existing condition. I says, no, you can't do pre-existing condition. He goes, only it's not a pre-existing condition if you go through the exchange. But since this is a private insurance, he says we can say it's a pre-existing condition, and we're like I said, we could give you insurance, but we're going to exempt your heart and we're going to exempt your wife's disease. So I told him, screw you. So I went to the exchange and I applied for to see what else that they have out there. Well, I got Blue Cross Blue Shield. And when I got the Blue Cross Blue Shield, I made sure it was a PPO. Said if my wife could go back to Northwest Hospital. I wasn't worried about me. I was worried about my wife because she needs to go to Northwestern. So I got a policy for $647 a month. I think it's a five. I believe it's a $5,000 deductible. So anyway, a month or so later, two payments later, my wife's got to go for an appointment. She goes down to Northwestern Hospital, and they says, "Sorry, we don't take that Blue Cross and Blue Shield here." My wife says, "What? Sorry, we don't take that, but we got Blue Cross and Blue Shield. It's a PPO. We're supposed to be able to go anywhere with that." They go, "Well, no, we don't take that here." So I called Blue Cross and Blue Shield. I said, "What the hell's going on?" When I took the insurance, I made sure it's a PPO. They go, "Well, through the exchange, it's not really a PPO. It's more of an HMO." I said, "But it says PPO." She goes, "Well, yeah, but you gotta go to the hospitals and the doctors on our list." And of course, Northwestern ain't one of them. Okay? So the bottom line is my wife can't go back there now. What are her choices? She can go to Mercy Hospital. If you know what Mercy Hospital is, it's a hospital. Nothing special. Or she can go to U of I, and I'm gonna try and get her in there because that would be better. Her disease has no cure. So she needs to she needs to be in a hospital that's doing research, like Northwestern, the best hospital there is, Northwestern, because they were helping my wife. Now she's got to start all over again. So just now, I went on the exchange to see where I'm at with the exchange and what's the difference in money. Where do you get a load out of this? The same policy, just about that I had, is $875 a month. 14,300 deductible. 14,300 deductible. But I don't know if that's the exact plan, the same plan. It's either that one or there's one for almost 1,100. And this is with the $647 a month discount. So if I didn't have that discount, it would be $1,400.75, or it would be $1,600 if I just didn't have no deductible or I made over a set amount of money. So this is what we're looking for. And then I was looking at to see what kind of other there. Well, United Healthcare ain't listed no more. They sucked anyway. But they get the only other one that they got there is Cigna. Never heard of it. And Blue Cross and Blue Shield. There's no other choices. So, bottom line is, vote for Hillary Clinton so that you can get a $14,000 deductible insurance and pay $1,000 a month. Now, I don't know about you, but $1,000 a month, I can't afford that. And even if I could afford to pay the $875, if we use that freaking insurance, how the hell am I ever going to pay the deductible? And that $14,000 deductible is each person. So I'm voting for Trump because I feel that Trump's going to help this. And all of this stuff is fact. In 2010, $95 a week insurance. That's $4,940 a year. When I got the private insurance, that was $125 a week or $551 a month. That's $6,582, and that was like a $5,000 deductible. The Blue Cross and Blue Shield that I got in the second part of last year is $148 a week, or $7,728 a year. Well, I think it's a $5,000 or $5,500, $5,700 deductible. But this year, $875 a month, $14,300 deductible. If you if you went to the hospital like I had to go, they didn't pay the hospital bill. So right now I'm suffering. I got to pay $43,000, or I'm fighting with them because I'm not paying it. But just think. Now I ain't even talking about the stuff that my wife's doing. She's got a ton of freaking hospital bills, over $4,000 already. 4,000. So now I got to pay this plus the $4,000. That's me and her. But then I still got my stuff. I got a $3,000 ambulance, almost $3,000 ambulance. I got a $4,000 doctor bill for the surgeon, and a $43,000 hospital bill. Somebody please tell me what I'm doing wrong and how in the hell I'm going to pay for that. I rest my case. Vote for Trump.